1. Due to a tumble off his bike, the 12-year-old child shattered his arm. The nurse is aware that once the injury has been cast, it is crucial to carry out all of the following assessments on the area nearby the injury, with the exception of A. Radial and ulnar pulse. B. Capillary refill. C. Finger movement. D. Skin integrity. When a call bell rings, the nurse answers it to discover a terrified mother holding her child, who is experiencing a seizure. Which of these should the nurse choose to do? A. The nurse should help the mother restrain the child to prevent him from injuring himself. B. The nurse should clear the area and position the child safely. C. The nurse should call the operator to page for seizure assistance. D. The nurse should insert a padded tongue blade in the patient's mouth to prevent the child from swallowing or choking on his tongue. 3. Which of the following microorganisms causes rheumatic fever to develop? A. Streptococcal pneumonia. B. Haemophilus influenza. C. Group A beta hemolytic streptococcus. D. Staphylococcus aureus. 4. Which of the following characteristics is most likely to be present in a cerebrovascular accident, CVA caused by a congenital cardiac condition? A. Polycythemia. B. Endocarditis. C. Low blood pressure. D. Cardiomyopathy. 5. A metabolic flaw that is inherited that causes RBC to be destroyed too soon? A. Celiac disease. B. Homocystinuria. C. Phenylketonuria. D. G6PD. 6. Which of the following is improper when giving chemotherapy to a young patient? A. Observing the child for 10 minutes to note for signs of anaphylaxis. B. Assessing for signs of infusion infiltration and irritation. C. Monitoring the child for both general and specific adverse effects. D. Administering medication through a free-flowing intravenous line. _7. A woman confides in the nurse that she is distraught over the fact that her 2-year-old son doesn't finish his meals. The nurse should give the mother what advice? A. Do not give snacks to the child before meals. B. Make the child sit with the family in the dining room until he finishes his meal. C. Provide quiet environment for the child before meals. D. Put the child on a chair and feed him. 8. Nurse Rose believes that a 4-year-old youngster is being physically neglected. Which question should the nurse ask the parents in order to properly assess the child's nutritional status? A. What did your child eat for breakfast? B. Do you think your child eats enough? C. Has your child always been so thin? D. Is your child a picky eater? 9. The nurse is looking for evidence of improvement in a female youngster who has acute post-streptococcal glomerulonephritis. Which observation often represents the first indication of progress? A. Increased appetite. B. Increased energy level. C. Decreased diarrhea. D. Increased urine output. When doing an IM. Which place should the nurse in charge choose for an injection to an infant? A. Ventrogluteal. B. Vastus lateralis. C. Deltoid. D. Dorsogluteal. The nurse in charge notices an infant's unusually low-set ears during a physical examination. This discovery is related to A. Renal anomalies. B. Autogenous tetanus. C. Tracheoesophageal fistula. D. Congenital heart defects. When Doris takes her infant in for a well-baby checkup, she asks the nurse when she should start feeding him solid meals. Which solid food should be introduced initially, per the nurse's instructions? A. Egg whites. B. Yogurt. C. Rice cereal. D. Applesauce. Wilms tumor is discovered in a young child. The nurse in charge of the assessment hopes to find A. An abdominal mass. B. Dysuria. C. Nausea and vomiting. D. Gross hematuria. A young patient is receiving medication intraosseously from Nurse Pressy. When a child is, intraosseous medication delivery is frequently utilized when A. Over age 3. B. Critically ill and under age 3. C. Under age 3. D. Critically ill and over age 3. A 6-year-old female girl is brought in for a checkup at the medical facility. The nurse should inquire as follows to evaluate the child's vision. A. Do you have problems with glare? B. How are you doing in school? C. Do you have any problems seeing different colors? D. Do you have trouble seeing at night? Which of the following should Nurse Carmen consider when developing a lesson plan for the parents of Abby who has been identified as having pulmonic stenosis, PS? A. Obstruction of blood flow from the right ventricle. B. Return of blood to the heart without entry to the left atrium. C. A single vessel arising from both ventricles. D. Obstruction of blood flow from the left ventricle. Nurse Menchie is aware that children of which age group are most likely to perceive illness as a punishment for wrongdoing while creating a plan of care for a hospitalized child? A. School age. B. Adolescence. C. Infancy. D. Preschool age. 18. Victoria, a 5-year-old girl, has lately been identified as having Kawasaki disease. In addition to the disease's known symptoms, which of the following is also a possibility for her to experience? A. Meningitis. B. Mitral valve disease. C. Aneurysm formation. D. Sepsis. (19) 12-year-old Erithel is 7 months pregnant. Which teaching method is least effective when teaching parenting skills to an adolescent, according to the nurse? A. Providing age-appropriate reading materials. B. Providing a one-on-one demonstration and requesting a return demonstration using a live infant model. C. Initiating a teenage parent support group with first and second-time mothers. D. Using audiovisual aids that show discussions of feelings and skills. (20) The nurse is aware of the following assessment finding as the most typical one in a child with ulcerative colitis. A. Abdominal distension. B. Intense abdominal cramps. C. Profuse diarrhea. D. Anal fissures. (21) Thrisha is admitted to the pediatric unit with what is thought to be rheumatic fever. Which facts does the nurse prioritize when gathering the child's medical history? A. A recent episode of pharyngitis. B. Vomiting for 2 days. C. A fever that started 3 days ago. D. Lack of interest in food. Pediatric Nurse Practice Test. Pediatric nursing focuses on providing medical care to children from infancy through adolescence. These nurses work in various healthcare settings and must understand child development. Strong communication skills are essential for working with both young patients and their families. Pediatric Nurse Certification. The Certified Pediatric Nurse (CPN) exam is a critical certification for pediatric nurses looking to validate their expertise. This exam consists of 175 multiple-choice questions, 25 of which are unscored pretest items. To qualify CPN exam, candidates must have a current RN, registered nurse license, have a minimum of 2 years of clinical experience in pediatrics, accumulate at least 3,000 hours of pediatric nursing practice, register for the exam at least 90 days in advance.